Hey, everybody. This is Marci Evans, and I am joined by my newest colleague, Anita Dharwadkar. And I am so grateful that we are going to be having this conversation. We're going to be, as I had mentioned, talking a little bit about the intersection between eating disorders and mental health and chronic illness, which is it's kind of astounding how we don't discuss this as a field. When Anita and I were first getting to know one another, that was one of the things that really grabbed my attention, that this was an area that she has a lot of passion for and a lot of knowledge in. Some of that informed by her own lived experience, and then also informed as well by her clinical experience. So she has been my teacher on this topic. And so I thought it'd be really, really cool to talk about it together for a few minutes and to share this with each of you. So I'm going to be letting Anita take it away. I'll be asking a couple questions, but let's just start out kind of basic. What do we mean when we say chronic illness? It's kind of like this big catch-all term, but what does it actually mean?
Yeah. Everyone has a different definition for chronic illness. But for me, it's, being diagnosed with a disease or disorder that's something you're going to manage and kind of deal with for the rest of your life or a good portion of your life. For example, some of the common ones people might think of are managing diabetes, something like IBS, arthritis. POTS is another big one, endometriosis. So any of these diagnoses that you receive, that's going to be something that pretty much the rest of your life you're going to be dealing with and learning to manage. And I think what I've learned along the way is that it's really important that being diagnosed with a chronic illness at any age, but especially a young age, like in your teens or 20s or 30s, it's really difficult for someone to manage and process. Definitely there's a sense of grief and loss when someone's diagnosed with something that they're going to have to manage and kind of change the way that they do things day to day.
Yeah, I know. I also would imagine that it's not just managing the day to day, but it's also probably impacting the way that maybe they think of themselves or sort of how they see themselves in the world. Which actually it makes me curious to hear from your perspective. What is it about having a chronic illness or being diagnosed with a chronic illness that increases that susceptibility to mental health conditions in general, be it sort of anxiety or depression? And then, of course, our interest and our passion specifically related to eating disorders.
Yeah. So I'll kind of start with the eating disorder aspect. So we know that eating disorders thrive on having control when often other aspects of an individual's life feel out of control. So that might be a trauma, that might be, perfectionistic tendencies, mom and dad going through a divorce. So wanting to control something. And so getting a chronic illness diagnosis makes you feel very out of control. So many people in turn, they'll turn to what they can control in the moment, which might be food or movement, as a method to regain some of that control. So I really think that's one big aspect. The other big aspect is after getting a chronic illness diagnosis, people may feel like their body has failed or let them down if they can't do the things that they used to like to do. And it's really frustrating and complicates the relationship one has with their body. So not only are they more susceptible to struggling with body image on the outside, but susceptible to struggling with how they feel about their body from a physical perspective, as my body can't do the things that I used to like to do. And along with that, often there's a lot of body changes that come along with chronic illness, a lot of weight fluctuations due to different diets or different medications, that people have to adjust for health reasons. And of course, with the society we live in, a lot of the times people receive compliments or comments that are either positive or negative about one's body, which of course they don't know what's going on the inside.
So there could be a lot of just pain happening on the inside and changes that feel really out of control. And then on top of that, you're sort of interfacing with people in the world in an environment that doesn't get it and is giving sort of this feedback. That's understandably incredibly stressful and unhelpful.
Yeah.
I would love to hear just kind of, I know this is a more brief conversation from your lens, what eating disorder providers specifically can do to look at this integration a little bit more and understand kind of the interplay between chronic illness and eating disorders, and what you wish in general providers knew and understood to support their clients who are both struggling with a chronic illness as well as an eating disorder?
This is definitely a loaded question, so I will try to keep it brief for the sake of time. But, I think there's still a lot as just medical providers in general and eating disorder providers in general that we're learning continuously about chronic illness and the intersectionality of all of these different things. Definitely the do's for a provider would be to validate and listen. Even if they're talking about something that's maybe not in your realm or your wheelhouse, they're bringing it up because it's on their mind, and not every provider gives them the space and holds the space for them to be able to talk about, the symptoms they're feeling or the pain or the emotional pain that they're going through. I specifically remember the one provider that did listen to me, but I also remember all the providers that didn't listen to me. So whatever you say and do, every interaction you have is going to stick with them. My other piece of advice is to really think out of the box whenever you're working, with everyone or with someone with a chronic illness, really thinking of it from a holistic point of view, kind of the mind, body, and spirit. Because so many times, like, you go to a cardiologist and they're just looking at the heart, or you go to a gastroenterologist and they're just looking at the gut. And as nutrition providers, we're looking at the diet, but we should be thinking about all of these things that are impacting the diet and the way they view food and their body. So there's actually this phrase that's taught to medical students throughout their training. When you hear the sound of hooves, think horses, not zebras. Essentially teaching medical providers to assume the simplest diagnosis, as zebras are rare and horses are common. So many medical professionals seem to forget the zebras do exist. And so getting a diagnosis and treatment can often be really difficult because that's what they've been taught their whole career. So really kind of unlearning that from a medical lens is something that people with chronic illness face. And help be an advocate for your patient or your client, sit down with them, do research on different specialists, different tests, just advocate for them with whatever your capacity for that is.
No, that's incredibly helpful, and helpful just to have some basics to remember. Like, it shouldn't be that far of a stretch as a provider who is hopefully deeply caring and empathic. That's why we do the work that we do. That the first step is actually to make space enough to listen to your client's experience and to try to get it without sort of inserting our own assumptions or our own bias or our own experience. It's just really, really ask and listen to the experience of our clients in front of us, and then think as creatively as we can to try to identify maybe some solutions, like what are the rocks that haven't been turned over yet, so to speak. And that even just starting there in a fundamental way can go a long way for folks who maybe have had a lot of experiences in perhaps medical interactions where they haven't felt listened to or believed.
Yep, absolutely.
I'm so glad we're talking about this. I know this was a really quick kind of starter conversation, but I'm excited to see where this conversation leads. I'm excited to see where the work that you are doing around this topic leads, because I know that this is a conversation that is so near and dear to your heart. So thank you for making the time, and we'll, direct everybody kind of back to the newsletter, where we're going to provide some referrals and resources to do a little bit more learning if this is of interest to you. So thanks again.
Awesome. Thanks, Marci.
Bye.